the denture experience can often be a very uncomfortable and frustrating one. I hear from a lot of patients, particularly with a poor fitting denture, it will cause a lot of frustration, a lot of embarrassment, a lot of pain and discomfort. As dentures move around in their mouth, they rock and fall out sometimes. Even with a great fitting denture, what they can do is actually cause a failure of the teeth that they latch onto. So we find that there is a failure rate of about 80% after 10 years of healthy teeth from holding in this denture, just from rubbing and from torquing forces that are applied from the denture to the teeth. Now, one of the greatest innovations in dentistry has to be the dental implant. What a dental implant aims to do is mimic the root structure of a pre-existing tooth. And so what we're able to do with a dental implant is now give the patient a fixed permanent option to replace removable teeth or to replace missing teeth. This can be done in the setting of one or more missing teeth, up until the point where we can actually restore an entire arch so that full dentures are now a thing of the past. So in a pain-free dental visit, we place a titanium screw inside the jaw and we allow it to heal for about 4 to 6 months. We then come back and restore this with a tooth to give the patient a natural looking smile. We combine the latest in 3D X-ray technology along with intraoral scans to carefully diagnose and plan the positioning of the implant or artificial root, so to speak, along with the crown before we begin in order to create that natural looking smile. Through these careful diagnoses, what we're able to do is perform the equivalent of what we would call keyhole surgery. Our mouth guard is fitted into the mouth, and through the mouth guard, we were able to place the implants in exactly the right positions that we had previously planned. The beauty of keyhole surgery, as we all know, is minimal post-operative pain because of the minimal invasiveness of our treatment. We couple this along with pre and post medications that aim to reduce the amount of discomfort and increase the amount of success that we have through a treatment. This is done through analgesics, antibiotics, and again, corticosteroids to reduce inflammation so that patients are coming back and reporting to me that they don't have any pain about 48 hours after. The medications are prescribed after the patient has had a full blood analysis, so that the treatment and the medications are tailored to each individual case. Now, it has to be mentioned that implants are definitely not for everyone. We have to assess the patient individually. We have to assess the bone and their systemic disorders if they have any. And this is what makes implant placement such a successful treatment, is that we are very selective about the patients that can and cannot have an implant. And I'd also like to introduce my colleague, Dr. Ned Restom, who will be talking a little bit more about implants and what they entail.
Yeah, my journey with implants started in 2005. I graduated from 2004, and in 2005 I placed my first implant on my dad, my father. I've done the training in Australia here. I've done a few programs, including the latest was the master program through the Brenner Institute in Sydney, which is a collective 12-month program. Then I've done a lot of training in the US, done a full master program through one of the most elite institutes in the US, the California Implant Institute. It gave the American perspective on implant training. It's they've got a very broad industry over there with a big population base, a lot of private insurance funding and on all that sort of stuff. So we've completed that training program. I've completed that training program there, and it's accredited through University of Las Vegas Dental School. This allows us to treat all implant cases, from a basic case where someone's lost their front tooth following a trauma incident, footy field, to a high-end cosmetic case with people with a high smile line, including all the soft tissue. It's like sort of dental plastic surgery in a way. We also deal with a lot of cases where people haven't even had any teeth and they've lost their teeth a long time ago and their confidence has gone downhill. We design their smile based on a digital smile design which integrates the latest digital programs, the latest digital softwares, to enable us to architecturally design your smile in a way that you like, and we trial that smile before we even place the first implant. These procedures we do under local anesthetics, under twilight sedation or intravenous sedation, where you don't have any memory or recollection of the procedure, or even under general anesthetics in the private hospital. And that all depends on the patient comfort, their medical history. What I would say is we do a lot of talking, we do a lot of consultations prior to doing anything. We like to see you 3 or 4 times prior to even placing the first implant, just to make sure that you understand the whole process from the start to the finish.